Yeah, introduce a panel. The first panel discussion for the day on the 10th edition of Healthcare Leadership Forum is a very important one. It is on insights on COVID-19 vaccine and the rollout strategy and outcomes, which is a very hot topic right now, pan India, not just pan India, as a whole, globally. So I would like to introduce a panel here. We have Mr. Bhaskar, Bhaskar, Commissioner, Health and Family Welfare, Mission Director, Department of Medical Health and Family Welfare, Government of Andhra Pradesh. Thanks a lot, Mr. Bhaskar. Dr. Arun IAS, Secretary Health, Senior Smart City, Government of Puducherry. Dr. K. Madan Gopal, Senior Consultant Health, Niti Aayog, Government of India. Thanks a lot for joining. And Dr. Divya, VS, State Nodal Officer, Training and Telemedicine, National Health Mission, Government of Kerala. Before we start initiating the discussion, I would like to call upon Dr. Divya to make her presentation. She has a short presentation to make in. Dr. Divya, can you please start it? Yeah.
Good morning, one and all. Thank you. First of all, thank you for giving me this opportunity to present before all of you. Am I audible?
Dr. Divya, you are audible. Yeah, please.
Yes. May I share my screen?
Yes, please. Go ahead, please.
Is it visible now?
Yes, ma'am. Yes, yes, please.
So, very good morning to all of you. So, I'm just starting with the response to COVID by any stage. We are now familiar with a set of new words, a set of new activities, which actually have taken a new course in our life, in our health journey. Any state might have done all these things. When I just go through this presentation, everybody will be feeling that like we are doing some COVID analysis. No, these are just new words, very familiar and very used to, very routine words to us. So any state would have keep an eye on the trend of cases across the state, like daily cases. When the journey started, when the Wuhan children reached Kerala, I mean, not only Kerala, any state, Wuhan people reached, and we just kept our eye on daily new cases, then 7-day moving average, cumulative cases, active cases, recovered cases. And then we started thinking about doubling time, monthly case status, death, case fatality, comorbidity status of all the death cases. What is the test positivity, then surveillance on new strains, and which are the top 5 areas or districts or states. If you think in perspective of a nation, then we'd have called upon which are the states having highest cases. Then every state would have done all these things. We would have set a state COVID control room with multidisciplinary teams and district control rooms and call centers, screening of passengers and international airports or seaports or something like that. Then intersectoral coordination would have gone far beyond our imaginations. There would have a lot of new guidelines for testing, quarantine, admission, discharge. New infrastructures might have come into existence, like testing centers, treating centers. What is the ICU status, ventilator status, and how we are weight balancing as per the case in each centers. Then what is the status of our quarantine centers, first line treatment centers, and many layers of treatment centers, second line treatment centers, apex treatment centers. What is happening to the training and proper HR management? Then now we have always giving importance to the surveillance activities. Initially we started with our route maps, then contact tracing, then there is an epidemic disease ordinance, I mean epidemic control ordinance, then what is happening to our non-COVID patients, then palliative care, TB, communicable disease, non-communicable disease, tertiary care, are they being compromised? What is happening to the ambulance bed occupancy, private sector engagement, community health, volunteer group, targeted psychosocial support? Are we supporting them properly? So There came many telemedicine platform from government of India. Went ahead with e-sanjeevani. Then what is happening to our intensivist pool? Is there something like that? What is our critical care experts saying? Then came the post COVID, which is far more dreadly than what COVID did to us. And is it there? Post COVID clinics has been set up in PHCs, CHCs, or any grassroots level, taluk hospital level, medical college level. Are there testing kiosks working? Then what is the coordination mechanisms? Now we have reached to such a point where vaccines, we believe that vaccines will act as the main strength of the prevention of disease. And how can we distribute our vaccines among the healthcare workers, among the frontline workers, among the general public, that is the old age first and then the general public? Will the strategy work? So I just this is a Kerala specific slide where we have sectoral magistrates controlled by disaster management authority. They are intervening in the daily activities of general public. How they are actually actively participating in containment zone management strategies, actions against violations. The campaign is going on now also, break the chain campaign, that has got its own importance now, then, and always it will play its part. And there should be a protocol based management for all COVID cases. And coming to vaccines, what are vaccines? No, vaccines are not just medicines. They contain weakened or dead viruses or even just few proteins or sugars from its surfaces. Vaccines harness the natural activity of our immune system, trains the body's immune system so that it can fight a disease it has not come to contact with before. Vaccines safely expose our body to pathogens so that immune system can make antibodies capable for binding to their antigens. The body is left with a set of memory T lymphocytes. That's our technical gadgets everyone is now familiar with, as well as B lymphocytes. They'll start fighting for us against virus in future. But what is the most important part when we launch any virus, when we start to roll out any virus? It is the most important strategy that I think and everybody thinks that we should focus on is how we will communicate with general public. How will we what is that, convince the general public regarding the safety, efficacy, and what vaccine does to our body? That is the main and important thing that we need to think on. How we plan to communicate, to whom we should communicate. In any area, communicating with community leaders, religious communities, and general public directly has its own weightage to do. Strong support from healthcare professionals for vaccination should be needed, and communication directly and indirectly about the benefits of vaccines should actually rule the scenes. We need to discuss how side effects of vaccines are not going, and what does that side effects means, what does that AEFI means, what these technical terms mean. Will a pain on the injection site or will a fever of one day going to going to threaten them or prevent them from vaccinating their community and other members of family? And discussing the vaccine safety issues and concerns of the beneficiary, giving them a chance to open up is the important thing. Kerala has done 2-3 media workshops where general public can open up and ask their doubts via messages, and all the top administrative people, including the health secretary, used to answer what they are planning to do. All the influential doctors took their vaccines and publicly spoke about vaccines. And there should be a credible source of information which is accessible to all in all local languages, all colloquial languages. And we should ensure all staff are regularly communicating to their wards from panchayats, wards till the state. In each ward, we are having some sub centers, field health workers are regularly interacting with the people. Asha workers, Ankanwadi workers, they should keep on talking to the people regarding what how vaccines helped us out of the dark age of communicable diseases, how polio has been contained, or polio has been almost eradicated, how polio diseases used to, what polio disease used to did with us. So educational materials should always be available, but it should not replace the regular conversation, direct regular conversation between each healthcare worker to their beneficiary. That each ward is having an ASHA worker where each and every person is very familiar to them, and there should be a media engagement plan regularly. That media should regularly be updated how to actually tackle the rumors, misconceptions, and anti-vaccination arguments. And I'm so sorry that I took a lot of time, and here are some snaps regarding ensuring the services in among general public in rural Kerala. And these are the district program management and support units working as control room. And these are the working sample kiosks where initially we had some shortage of PPE kits. Then this is how we managed to test identity.
Thanks.
Thank you all. This is all from me.
Thank you, Miss. Yeah, yeah, thank you. I would like to quickly go to Mr. Bhaskar. Sir, I would like to ask you, how is the vaccination drive is going on in your respective state government, and how many, like, if you can just give us an update on like how many people have been vaccinated in the state, and if you can just tell us about the doses which has been given in your state, and what is the surveillance mechanism you're following in the state, sir? Over to you, sir.
Yeah, thank you. And first of all, let me thank the ELET for giving me opportunity to participate in this forum. And a quick hi to all the other panel members. I would be specifically focusing only on the vaccination part. See, vaccination, like other parts of the country, started in Andhra Pradesh on 16th, when the Honorable Prime Minister launched the program. So initially, we were asked to do only at 143 sites, and then later of Government of India had given permission to scale up. As I speak to you today, around 780 locations, we are vaccinating the people. In the first phase, currently only the frontline healthcare workers are being vaccinated, whose numbers for the state of Andhra Pradesh are 3.8 lakhs. Out of 3.8 lakhs, till now 1.8 lakh we have vaccinated. 2 lakh more person have to be vaccinated. And which vaccine we are using? We are using both. But the proportion is different. The vaccines allocated to us are from two organizations. Initially, we got Covishield. The number of doses of Covishield that we have received are 8 lakhs, and then we received around 2 lakh doses of Covaxin. So administering of both the vaccine is the same. There is an IT platform which is called CoWIN, which is same across the country, where initially the people who have to be vaccinated are being enrolled. The departmental people, which I am speaking about healthcare workers, and in the coming days, other departments like police, revenue, and also municipal workers. And today, recently, Government of India has also allowed Panchayat Raj workers. These four department workers database, we as a government organization, the health department itself is ensuring that this data is uploaded by the respective departments into the COVID website. And such people whose names are entered into the website, they are being issued time slots through the software itself, and departmental people come to the specified location where a session is conducted, which is all online. The entire planning of which place, on what date, the healthcare workers and other workers should come and get vaccinated is all planned through the IT platform, which is common across the country. And messages are sent to these people. They come, get themselves vaccinated, and then they go back. And after 1 month exactly, all of them have to come back for the second dose. So only after they have taken their second dose and 2 weeks have passed after the second dose, they are deemed to be immunized. Until that point of time, they are not deemed to be immunized, and they are at full risk of getting contaminated or getting contracting the virus from any other source. This being the thing, as I've indicated, out of 3.8 lakh, 1.8 lakhs we have completed. The rest 2 lakhs, I think in the next 10 days we are going to complete. And then as Government of India gives the clearance to go for the second line, which are the other workers, so we will be ensuring that those workers are also vaccinated in a time-bound manner.
Okay. If we can have Dr. Arun and Dr. Madan Gopal on the screen, please. Dr. Arun. Okay. Yeah. Dr. Madan Gopal, we are always happy to, get you talking, and we have a very informed, highlights from you. Quickly, I wanted to know, because Niti Aayog was spearheading the vaccination drive, so we would like to know, like, how you're seeing. It's been, about a month now, the vaccination has started, and how you're seeing the trend, and, if you can just tell us about the whole vaccination drive, the first phase with the frontline workers, how it is going.
If you look at the scenario across the globe, so as of yesterday, it was 82 million. That means if we are including the figures from the other vaccination, other sites, that is China, Russia, and others. But the whole momentum gained during the month of December, when the US and UK they started and the Israel they started. The US administration, they took 7 days to reach the 5 million, 0.5 million mark, that is 5 lakhs. Whereas we have reached the 5 lakh mark in 7 days, 5 days. Where the US and UK reached in 13 days, US reached in 7 days, and we have reached in 5 days. If you talk about the million mark, we reached the million mark in 7 days, whereas the US and UK they reached 11 and 20 days. If you talk about the 20 million, that is 2 million mark, we have reached that mark in 11 days, whereas the US reached in 15 days and UK 34 days and Israel 23 days. As of yesterday, what we did, if you look at the press briefings by the additional secretary, we are having around 47,000 sites now. You won't be surprised if the number of sites increases and the number of inoculations per site increases. The task is gigantic. It's not a small task. The progress which is happening, it is going slow currently. Now, in the coming days, if you have seen that the first across the globe, the first 5 lakhs reached in a particular period of time, and afterwards, if you look at the other data from US and this, they have reached around 5 million data in 24 days, 2 million in 15 days, and 5 million in 24 days. UK, they have reached a 2 million mark in 34 days, and in 40 days in another 9 days. That means as the immunization is progressing, they are getting some confidence because it's a new vaccine. We are having a adverse event following immunization surveillance system in place with the UIP vaccination. But this is a new vaccine and it's all emergency use authorization. That means you have to have a robust adverse event surveillance system in place. So that's why initial things was very slow. Now, as we are getting mature, as the sites are evolving, as we are getting confidence, you will see number of immunization sites and number of inoculations happening at a very, very faster pace. Till now, the progress has been very satisfactory. And as more and more people, more and more institutions are coming forward, now in many of the states, the private hospitals, the private providers are also now getting inoculated. As a result of which, now you will be seeing that in a day, we will be reaching around 5 lakh inoculations per day. That kind of numbers you will be witnessing in the coming days. As the way things are happening. So right now, the things are more or less on that particular pace, and it's quite satisfactory that drive which is happening. And the question which you started with the first presenter, you asked that key, how the outcomes of the vaccines would be there. That's a very interesting question, but it's too early to ask on that. We, when the when the pandemic started, we are not clear what to do. Whole of the world was caught on the wrong foot. But we stick to the basic, and as the epidemic involved, now we are having standard operating protocols, standard guidelines, everything is now in place. We know that if somebody is having COVID, what to do, what kind of treatment is to be provided to that person. At that time, there was talk that we should be having vaccine. Once a vaccine will come, it would be a Rambam and we will be controlling this. It's not the case. The vaccine will prevent the adverse events, adverse effects of the COVID infection. You have to prevent yourself from the virus. And it's an emergency use. That means it will prevent the catastrophe following COVID and other things. But if I'm inoculated, it's not necessary. It depends on the system. Virus can enter into my body, but it will not be able to cause harm to the body once it enters. That the vaccination is that. We should be clear on that. It's not that it will prevent the entry of the virus into my body. That kind of misconception has to be upfront dealt. The second thing is the virus is more effective. If you look at the studies, they say that the person who is infected, if you look at the antibody titer after the infection and the antibody titer after the vaccination, there is a marked difference between the two things. The infection is not able to give that kind of titer which the vaccine is given. And after the infection, after 3 months, 4 months, the titer is reducing. And how much titer would be giving protection? That studies are going on. They are still studying that. But nevertheless, the vaccine gives a very high titer as compared to a natural infection. That's more or less they have been able to establish. Apart from this, after 2 shots, after the second shot, second jab is a term which is a replicant. After the second jab, 2 weeks following that, that means it provides a sizable amount of titer which can give you a protection. And besides that protection, because you are still exposed, because sizable population is still either they are infected by the virus or either they are vaccinated. We don't know whether the herd immunity will play a role in this or it's too early to talk about what could be the herd immunity. We are just exploring. You will be listening to a lot of many schools of thoughts will be saying that herd immunity is already set in. I was surprised too. If you looking at the today's data, Chhattisgarh, we were going slowly. We have reached less than 10,000 cases 2-3 days back. Today is 18,000 cases. One of the states, Chhattisgarh, which was small, it has overshot the Kerala cases for the day today. So that means we don't know. We can anticipate the moment our guard is there. The only effective vaccination till was the masking, the social distancing, and other things. That will continue. And if you look at the benefits of that thing, as a medical professional, I can say that during the last 1 year, you see that many of the households which were having an episode of ARI 2-3 times a year, now this time very few households they have reported ARI episodes. Very few households they have reported diarrhea episodes. So that means that appropriate behavior we have to follow. Vaccination will come, and if a sizable population, number of population are inoculated, then we can say that we have at least control the pandemic. Till such time, we have to follow both the things. So vaccination will continue, as well as the COVID appropriate will continue. Otherwise, we will see surge of cases, and we don't know how it is going to affect this thing. The post-COVID sequelae on the health system, they can talk about the health system, this would be the requirement. But what it is affecting the human body, kind of few early signs, early indications, they are not very, very promising. It is affecting your metabolic system. It is affecting your other systems as well, apart from the lungs. Even now, there are cases that the person is admitted with diabetic ketoacidosis in UK. They are some of the people they say that the person is admitted with diabetic ketoacidosis. Once a COVID test is done, he's positive. Otherwise, he's not having that apparent symptoms of this. It can manifest in that form also. People will stroke. They don't have any history of other things, and the moment you test after the admission, you are fine. You don't know okay, what kind of symptoms and what kind of catastrophe will happen with the people. Since the time the vaccination happens, a sizable number of population is covered, and we are able to achieve a sizable herd antibody levels. I am not calling it herd immunity. I'm calling that sizable antibody levels are there so that we can contain the spread of the virus as well as prevent the catastrophe due to this. And the other question which was there, let me answer that the question which you have given to me.
Yeah, sure. Go ahead.
Other question was the adverse event following immunization. So initially the speed was slow because of this factor, because we want to strengthen the system also, because it is going parallelly. So this system now, as the vaccination, more and more people are getting vaccinated, then slowly and slowly now we are seeing that the systems are in place and the speed is falling. At the district level, you are having a district level committees who just watch on this. In case of any adverse event, they try to establish a causality to this. And after doing the due diligence about the causality, they send the report to the state thing, and from the state it comes to the national. And the pharmaceutical company, they directly send it to the regulator as well. That kind of, so that once the causality is established, then only we can say that it's an adverse reaction to the administration of this vaccine. Till such time that investigation is complete, we can't establish saying that this is due to this vaccination. So there's a set protocol and the system is there, and through the system they establish the adverse event, and after the agreement of the state and the national level and then they say that that's the causality is there because of this vaccination. That's all from my side. Any other question? I'm happy to answer.
Yeah, I would quickly go back to Dr. Arun. Dr. Arun, we would like to have an update, like from Government of Puducherry, like how many, how was the vaccination drive going on in the Union Territory, and how many health workers have been vaccinated? If you can give us an update on it, and what kind of strategy has been put on place, and how you're going through the whole vaccination process till now. If you can quickly update us on that. You need to unmute yourself, Dr. Arun, please.
Yeah. So as per the Government of India's guidelines, we started our vaccination drive on 16th of Jan. And we can say that, proudly say that ours was one of the session site which was live telecasted in the national mission also on among the 15 sites. So the intensive awareness and more than a dozen kind of training program awareness has been started here along with the Government of India. Third is intensive awareness. So as per the Government of India guidelines, three phases has to be done. The first phase is for the health workers. Second is for the frontline workers like police and revenue officials. Third is for the vulnerable age. So the first phase we have already started on 16. We have, in fact, we have done the demo, and like any other state, we have done the mock vaccination and other things. So on 16 we started. So we have 25,000 beneficiaries, almost 25,000 beneficiaries here. Healthcare workers, only healthcare. So, but there is some sort of a hesitancy. More than 40%, almost 40% covering on a daily basis is coming, 40 to 60%. So the first day there were some hesitancy were there, but as of now, almost 40% on a daily basis. So we have identified 135 session sites, but as of now, the Government of India is only at only 8 session sites per day. Yeah, so each session site has 100, so 800 we have to do. So out of 800 on a daily basis, 400, 450 people we are doing the vaccination. So, but intensive awareness is going on. As one of the presentations, one of the speakers also explained about the communication strategy and all, like involving the these religious leaders, and all those strategies are also being carried out here. I'm sure throughout India it is being done, like more and more awareness, more public outreach, telling about the pros and cons of this, and all those things is going on. Of course, along with this, COVID appropriate behavior is also very, very crucial. That should also go hand in hand. Thank you.
Okay. So I would like to ask the other question to the panel here. I will start off with Dr. Arun itself and then I'll go to the other panelist here. How is the CoWIN app happening? Because there was a kind of glitches initially, particularly in Maharashtra, we had found. So how helpful is this application and how you're trying to, use it in the grassroots levels? Like, this is a very important technology which is now being used. So this also helps us to know about the IT, how we are using it in the healthcare is a very big, important model to go on. Dr. Arun, your inputs, please.
Yeah, this, I think it is first of its kind where such an app is made from end to end for the vaccination purpose. Of course, it's a very good app where the entire movement is being tracked, and from the cold chain, from till the vaccination, beneficiaries' details are being updated, and each and every beneficiaries are also getting a reminder on the 28th day for the second dose. Of course, there are some niches. Since Pondicherry is a small place, we have good network. Network connectivity is not a major issue, but the portal and all were not able to be opened a few days back also. So those we are communicating to the ministry and we are rectifying those things. I think it's not just here; in many places also the same server related or portal related issues are there. What we and in the first day, what happened was where when the beneficiaries were listed out, and those beneficiaries did not come, so or may not be interested to take. So some sort of a modification would definitely be required that whoever takes it, then the portal can be updated as an need arises. This can be thought of. Second is what we have done because of the hesitancy, vaccine hesitancy and all. We have a COVID war room which we established for managing the COVID. We have a IVRS system also. We started calling each and every beneficiaries on the previous day itself, saying that we have to go to this special site and get vaccinated. So which we will be following it. Apart from that, on the 20th day also we will make a telephonic call. Because hardly we have to call 300, 400, maybe for 500, 600 people on a daily basis. That we have automated IVRS system which we have incorporated here. That with the help of the technology. So we will be calling them individually, we will call them along with SMS and all because many may not see the SMS these days. So apart from that, the COVID also has the app also has a very good features. So in addition to the COVID app, we have upgraded our IVRS technology and the COVID model to to make this entire operation very smooth and very seamless. Thank you.
Oh, okay. Dr. Divya, your inputs on the CoWIN app, if you could just add on how is the state faring on that?
Um, Initially, we also had some technical issues in rolling out because till the last day, the day before the launch, we were actually in doubt whether we can generate the list of beneficiaries. By midnight 2 a.m. we could actually try that. We got the beneficiary list for the first time. Then actually after the initial glitches it is going on fine. Like Arun sir rightly told, we are actually coordinating a bit manually also. After generating the list we are actually contacting the persons in person, and we'll get a rough estimate of how many persons are not going to come on each half day sessions. So by noon we'll know that in major institution we'll know that there is 25 persons are not coming because of lactating, because they are pregnant or something other than some other reasons. Then we'll try to pool from the administrative offices nearby where healthcare professionals are actually registered from there. So then that is actually easy for us to manage these lists to reach the nearby major health facilities. But the thing is, in minor health facilities, like now that many vaccination centers have been started, then small health centers doesn't have this luxury. So they are actually facing this information delay and information the persons not being able to contact us back, how to inform that we are not coming. So the the portal as such, it is very good. We are actually getting used to it. It is being reflected very well. Our persons are also being used to it very fast, rather than when compared to any other portal we tried to launch, or when any other portal we tried to what is that, push to the grassroots level. Cowin is one portal which actually started going along with the health care workers or the managers very easily. That is my input.
Yeah, quickly going to Dr. K. Madan Gopal, sir, how this Coven app is actually an exemplar or an example? Will it now an example? It is going to be an exemplar. So, can you tell me how this can be seen and the future scope of this challenges, though cited by the state government representatives here? So, if you could just help us with your comments.
Uh, Pratima, this is very one thing which we have to understand is that the circumstances under which we have extended the existing vaccine intelligence system to cater to the needs of the COVID vaccination as well. It's an add-on to the EVIN application, and this is evolving. If in 2-3 months' time, if such an application is made, and that is more or less is minor glitches, that means the beneficiary data and other thing that has now been addressed on a day-to-day basis. With minor glitches, the rollout has been very smooth. We can't say that in a 2-3 months time if some application is there, otherwise there would have been a chaos had it been left to that case. So many doctors are there, there would be rent seeking and other kind of things would have happened. But with this kind of application, now we are having data, though there will be some delays, some glitches here and there that have been addressed. Now if your name is registered in that institution, at 3 o'clock you can walk in there and you can get yourself inoculated. That kind of guidelines have also been released now. Now, if I want to get vaccinated, I can go to any institution where my name is there. I can get myself vaccinated during that time. Because as the things are evolving, it's a very, very mass immunization. And making a software in 2-3 months is not a small task. They have made this software, it is now working, glitches are there, it will slowly and slowly that glitches will be handled. The moment it is opened now, the data of the frontline workers is also being collected on this COVID application. Is a bulk upload facility was there and individual upload facility was also there. The individual uploads facility will be now be opened after a particular while once the system and the architectures and other issues are addressed. For carrying out this vaccination, this has evolved nicely and it is serving the purpose for which it was designed. And 3 months, in 3 months they have rolled it out. It is evolving and it will become it will become a public good for the international community as well. It's not that we will be only restricting. Once with the vaccine mandatory, the second phase, I think this technology and other things would be also transferred to our friendly and neighbor countries for use into this COVID. It is evolving,
Oh.
and whatever glitches are there, that will be addressed.
Yeah. So I would like to come to the panel to the last final question, but very important question as of now. There are a lot of myths and misconceptions around both the coronavirus vaccination, which is available right now in our country, and how should we dispel these myths? Yes, there are a lot of initiatives taken by the various state governments and the central government, but from you all I want to know. And also there was a few deaths which has happened in 24 hours or in 5 days of taking the vaccine, and they have been ascribed to cardiovascular problems or brain stroke. So what is your thoughts on it? Like let's give a message, a larger message to the audience who are watching us, and about the vaccination here. I would like to go on with this question to first to Mr. Dr. Arun. Your thoughts?
So, this was expected, as I was telling. There is eagerness for vaccine and also there is hesitancy. So the hesitancy has to be, countered with intensive awareness campaign. The intensive IEC has to be established, involving the religious leader, involving the see, one of the strategy of government of India to first vaccinate the healthcare official itself is a kind of a good intention that once the healthcare have been vaccinated, the others can be easily extended to other categories. So intensive awareness is required, and we have done a great job. And I think most of the states have also done their exercise, involve the social media, and some apart from this, we have established one dedicated helpline for this purpose. And whenever any person has any queries related to the vaccination, they can contact us on a toll-free number. We have established 104 for that purpose. Apart from that, any rumors that is being circulated in the social media or in any of the things that where criminal action has to be initiated for this purpose. So both regulatory mechanism, intensive awareness, both should go hand in hand so that then only we can counter this one and that we have to dispel these rumors. And as far as Pondicherry is concerned, we were not able to observe any of the major adverse effects apart from some body ache and fever for a day or so for few officials. There is no major adverse effects which we have encountered. So intensive awareness is crucial and keep engaging the general public. That is also very, very crucial in this exercise.
Dr. Divya, your thoughts on this, please.
Yes, actually, this is the most important part when any state or any division is trying to launch any new thing. But vaccination is something different because actually, initially itself, we are having a certain set of misconceptions among people. Here also in Kerala, it is less. Still, we are also having a certain pocket where it is very difficult to throw messages, very difficult to go for any peripheral immunization visits. So we need to have a good strategic plan by engaging with religious leaders, engaging with talking with the most influential persons in that community. Here actually one area is Malappuram in Kerala where we had a difficulty, but then also our DMO, district medical officer, and team had a good effort to talk with all the religious leaders, all the politically influential persons. And first of all, what state did was to hold a media workshop where honorable health minister chaired the meeting with a good panel of doctors and administrators who were ready to take actually the most common question we had is when will the general public get vaccines, when will NRIs get vaccine on priority. So that actually that questions, like people coming forward with huge enthusiasm, will provide as a motivating what that will provide actually confidence to others who are suspecting on vaccines. And also here actually there is a good health seeking behavior among themselves, so they are well aware of the words like antigen antibody reaction, what is happening in Norway, and how many deaths happened in Norway, how many deaths happened in Bangalore, and they will ask us how the death happens. So how AFI, how common is AFI, what is the mechanism of AFI, all these things should be in very simple languages, very easily readable and digestible to every single person. And what we did is one campaign, that is largest vaccine drive campaign, and through actually social media. Also social media is now becoming very strong, where we can actually give good write-ups in common man's language. What is happening to what is happening when a body gets vaccination. These are the simple
Okay.
strategies that any state is doing, but specifically what is doing is continuous engagement with general public, religious leaders, media. These are the three highly targeted and focused people where we are giving communication.
Okay.
Thank you.
Yeah. Dr. K. Madan Gopal, I kept you last because I want you to actually summarize it for us, like, for the viewers. Can you just tell us, because you, coming from Niti Aayog, your words are really important for us at this juncture. If you can just tell us about it.
Pratima, very interesting things you asked to summarize. The only thing is that we are having only two choices. One is either we take the virus or either we take the vaccine. That's one thing. Second thing, wherever the people they have set an example, suppose the chief medical officer of that particular health institution, if he comes forward and gets himself inoculated, whole of the team follows. That is doing wonders. That means in the private institutions also, the head of the institution coming forward and getting himself inoculated, whole of the staff is following. Wherever that thing have happened, the champions have happened, you are having a conversion of near 100%. Wherever the other the senior faculty, the faculties and the other person, they have shown some restraint. So the conversion which is taking time for getting conversion. Apart from doing the other regular activity, there are many influencers in the community. You have to see that how these influencers are being provided correct information. Because the influencer, if they are not provided correct information, then it becomes very difficult to convince the people. You just take the example of a doctor. Suppose I am doing a consultation in a clinic. I am having a reception. If I have not trained my receptionist or the reception person properly, all the patients who are coming there, they will ask the reception person that how is the doctor. And if he says something very loose about the doctor, then all of the things are gone. Okay, that kind of sensitivity is there. So we have to identify influencers in the community. Previously, it used to be the religious leaders and others. Nowadays, there are different kind of influencers. You can see the mob and the other things which are happening. Despite COVID threat and other things, they are the influencer. They can give a call and people will listen to that call and they come. So we have to identify influencers, communicate with them, take them into confidence, and things will happen. Regarding the AEFI things, the set parameters are there. Unless the causality is established at the state, because it cannot be at the district level. Either the state will tell, either the national level will tell. That mechanism is there. And people should be aware about that mechanism, how the causality regarding the adverse events are established. That should be made clear. Otherwise, people say that if they die about the snake bite also after this after vaccination, they will say that it is due to vaccination. I can say to that extent. So overall, the bottom line is that till the time we are having a particular treatment, so either we have to take the vaccine or we are having choice between vaccine and the virus. And in the intermediate, we are having the COVID appropriate. That's the only three things which I can say. Over to you, Pradeep. Thanks.
Thanks a lot to all the panelists for such a important topic. May you had deliberated and given your deep insights. Thanks a lot to all the panelists here. I would like to ask Rajeshwar, can you please give us the speaker certificates? Thanks a lot, Dr. Arun, Secretary Health from Government of Puducherry. Thanks a lot, sir, for joining in and giving your thoughts on the important topic. Yeah. Thanks a lot, Dr. K. Madan Gopal from Senior Consultant Health, Niti Aayog, Government of India. Thanks a lot, sir. We've been bothering you a lot and we will still do that. Please come to our conferences and share your thoughts. Thanks a lot. And Dr. Divya, it was a very nice presentation, ma'am. Thanks a lot for joining in. She's a State Nodal Officer, Training and Telemedicine and National Health Mission, Government of Kerala. Thanks a lot, ma'am. Thank you so much for the time. Thank you. And Mr. Bhaskar, the Commissioner of Health and Family Welfare, Mission Director, Department of Medical and Health and Family Welfare, Government of Andhra Pradesh. He had some meetings, so he had to head on. Thanks a lot, Bhaskar, for making.
Hi, Niti.
Thank you. Thanks a lot, everyone.